Well, share with me a little bit about the fine line you must have when you're about to work on someone, you're meeting someone for the first time, they're like, I want a nose job, and I want a boob job, and I want liposuction here and there. How do you know when to take someone or not? Is it naturally you've been doing it so long so you understand psychological signs that you're going, I'm not going to get near this person because they're going to sue me regardless of what I do? Or you think it might hurt them? They want something, like they might have a Barbara Streisand nose and they want, you know, a tiny button nose. And you're like, no, it'll totally ruin your face. Trust me, you look good just the way you are, or just the little, you know, softening.
That's a very good question.
How do you make that call?
The fact of the matter is it's based on experience. And I think we're all naive at first, but then we learn that there are surprises that occur. Some people react much more favorably than you would expect them to, because they were very questioning and uncertain going into the procedure before they made the decision. Others will come in and say, I've heard you're wonderful. I know you can do this for me, and I worship, you're the best, that's the one to watch out for particularly. But we also have to judge.
Why is that?
Well, those are people who will easily become disappointed. They put you up on a pedestal because they expect something that may not be really possible. And if they're disappointed, they shift, they become angered about it. So we have to be careful of that type of a patient. But there are also other people who really are uncertain and need to hear some information repeated over and over and over again to allow them to make the decision that they want to move ahead themselves. And once they've made that decision, maybe by asking the question once and a second time and a third time just to hear it, they become comfortable with the concept or comfortable with their selection, and they become very good patients. The people we really have to watch out for are those with body dysmorphic disorder, patients who you think will never be satisfied no matter what you do. And sometimes they're very difficult to pick up on during an interview. Other times I've found I'll be discussing issues with an individual in a one-on-one setting, and it just seems like they ask a question about this aspect of their face and another aspect of their face, and then they'll skip to their breasts and maybe their thighs and their skin. And you just have the sense that they're never going to be satisfied with themselves. And that's led me to often turn the table basically and start asking them questions about their background, their experience, relationship with their parents, things that we don't normally probe into too deeply. But sometimes you can just see that they have issues often from their childhood, maybe a very critical father or an alcoholic mother that they could never satisfy. And so these people just have bad self-images, and they really need therapy, life coaching. They don't need